I'd like to call the Public Safety Committee meeting to order for September, please. Emergency Management.
Thank you.
Mr. Harrison, how are you, sir?
Good afternoon. I have one resolution request to adopt the mitigation plan. It's the one that we've been working on for 2 years. It was approved by DISHES and sent to FEMA, and FEMA has approved it pending adoption by all the municipalities. So far, we have 4. I got an email today, and I know Canaan has sent it in, so we'll have more of a Copake, Stuyvesant, Philmont, and
New Lebanon.
Lebanon.
It's on the Hudson
Artificially, what's that?
On the Hudson agenda.
Yeah, officially done. So
Great.
the hard part's done, and it's just a matter of each municipality adopting it. So this is for the county to adopt it.
I'll move it.
Second.
All in favor?
Aye.
Opposed? So carried.
Last month, we talked about the food pantries. I checked around. ESS does have a list of food pantries for Columbia County and Greene County. They update it every 6 months or in between if they hear of any new one that opens or one that closes. So we just linked it to our Facebook or our website. So that's what you can do if you want to. They have it. It's easy to find on their website. So that's it.
Thank you. Good work on that.
Any
Thank you.
questions? Thank you.
Thanks.
911, Kevin's not here. General resolution request seeking authorization to enter into leasing agreements and maintenance contracts with Repeat Business Systems.
Second.
All in favor?
Aye.
Opposed? So carried. Sheriff.
Evening, everyone.
Evening.
3 resolutions, receiving all grants. First grant is a police traffic safety grant. The awarded amount of $31,850.
Second.
All in favor? Opposed? So
I
carried.
know, I was waiting.
I know.
Second grant is the child passenger safety grant.
Second.
All in favor?
Aye.
Opposed? So carried.
Third grant is a pedestrian safety grant.
Second. All in favor? Opposed? So carried.
And I don't know if the other one's on there, but we're holding that resolution, for the fill for 21. Out of county, incarcerated report, as of August, end of August, we had $18,180 from Franklin County, $15,450 from Greene County, total for August $33,630. Year to date is 119,625. Previous last year, about 20,000 difference, 139,980. Beloved Metler report, as of 12/01, we had 43 incarcerated, 7 out of Greene County, 5 out of Franklin, 2 parole, and that's about it.
Anything else for the sheriff? Thank you, sir.
All right, thank you.
Public defender.
Good evening, everyone.
Good evening.
I just have one general resolution request, requesting authorization to review the contracts of my 4 counsel at First Arraignment attorneys for independent contractors. $40,000 a year they get paid, and it's all paid through a state grant.
Move it.
Second.
All in favor?
Aye.
Opposed? So carried.
Thank you.
Thank you. Fire coordinator.
I just have a couple of resolutions accepting some donations from Chatham School of the bus and
I'll move it.
Second? All in favor? Opposed? So carried.
the other one was just a slide out tool tray for one of our pickups. So that's about $3,000. So
Second.
All in favor? Opposed? So carried.
year to date, just some activity. I just, kind of an update on the Questar program for the high school students. We're up to 9 students this year. We had 6 last year. And interesting, we got, I think it's 6 from Columbia County, 3 from Greene. And the interesting little side note we found out the other day is 5 of them have no families or anybody else involved in the volunteer fire service. It's like cold from the street. So we probably never would have got that if we didn't have the program going at Questar. So we were able to get them on and get them joining the fire company. So that's good.
That's
Great.
Anything else?
Thank you. EMS.
This might be a record meeting. Fast.
No,
There's always the jinx though.
That's right.
Yeah, right. I'll say it's PJ.
An hour.
Not real.
We're talking budget. so
I know.
that's-
No, we're gonna whiz right through this. This is information only. I just want to make a revision to the preliminary 26 budget that I presented last month. One of the Fitch recommendations was that we do collaborative training with all the squads in a centralized location. We're going to do that in 26. Right now, we're working on what they call an RSI program. What it is a rapid sequence intubation program, which is meaningless to all of you here, I'm sure, but it's a very advanced technique that paramedics use. They have to have 2 paramedics to do it, and we require training to do it. So what I want to do is move some money. I think I'll be underfunded in our budget that we pay the squads for calls and moving throughout the county. Move some of that up into a training budget. All the medical directors from all the squads are on board. They will help teach this course. Like I said, it's a very advanced technique, and it actually includes paralyzing a patient so they can get an airway down and when to a critical patient. So it's very advanced, but all have agreed and the medical directors have agreed. So we're moving forward. Okay. And no cost to the bottom line, just shifting some numbers.
Great.
Okay.
Thank you.
Thanks. Was I the longest one?
Yeah. I can ask you a question. Since you brought up the budget in Fitch, I know that there's a lot of scenarios that we haven't explored yet, but do we have some kind of retainer to like continue using Fitch if you want to go back to them to implement some of those recommendations?
We do not. We had a retainer last year for a small amount of money. I think it was like $5,000, but I don't have anything in. The plan was we have a 3-year work in progress amongst all the agencies, okay, that we meet every other month in a workshop to work towards this. Like that's one of the things I just mentioned. And the plan is maybe after that period of time, you come bring them back to look over our progress and see what are the recommendations.
Just something quick, bus patrol, not with you, but
Okay.
I know that we had, it was quite a few months ago that we talked about patrol, and I think at the end of that meeting, we were all sort of in agreement that we weren't that interested in it, but that we were gonna call in the superintendents from the schools, and I think it sort of just slipped through the cracks, honestly. I spoke to Jim Bragg today. He's gonna try to put it together for next month's meeting. We'll have an executive session. Hopefully, we'll get the superintendents here so we can at least let them know what the cost involved was and see if there's, if the schools are interested in doing it. So I just want to sort of get that finalized, but we'll do it next month. Okay? Any,
PJ's, any noticeable change to counties and that's with, the budget's changing hands now?
We're working on it. I think I sent you an email. You should have gotten it like yesterday from Northern Dutchess.
I read it.
It's okay. That said that Empress would like to meet with the town supervisors and they're supposed to get a hold of me to kind of arrange that meeting. So to be determined.
anything else?
Back to what you just talked about with the buses. Have you looked into are they doing anything to go out to people once they get them, or no, it's still status quo the way it is? You write them a ticket, and we can't press.
So I don't know what the current status is. I do know that RFP that we did it's been so long that even if there was a decision to move forward, if there's a change in the plan, we'd have to do another
You can use
RFP.
it as a baseline.
Right, we could use it as a baseline, but I don't know the current
Just
status.
wonder
of
if
that.
things have changed on that, because that's the whole point of it. you
From
know?
what I've read and what I was told is that the prosecution part of it is the hard part, the collection of the fines.
Anything else? Anybody? All right, motion to adjourn. Second. All in favor? Aye, opposed? So carried. Thank you, everybody. 9 minutes. It is 3:45 PM. September 16th. 2025. We are gonna start with Director McGinn, Department of Health.
Hello.
Hello.
How's everybody?
Good.
This weather's beautiful, so we're all in a good.
Isn't it gorgeous?
Yeah.
All right. Any resolutions? First is to contract with Kale Consulting for staff development training.
I'll move that. And I wish I could join it.
I know.
That looks like a great agenda.
I'll
I
second
will
it.
let you know how it goes. I'm really looking forward to it.
All right, a motion and a second. Any further discussion? All in favor?
Aye.
Opposed? Carried.
And authorization carryover funding on multiple grants from
Move it.
24 to 25.
Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
And then, my director's report, which I'm happy to answer any questions.
How many communicable diseases can we see in a month? I think that's.
You know, foodborne, thrown some mumps, some BAS.
The COVID shot, can you explain what's available for people? I've had people ask.
I
me.
wish I could explain it. We're still, the ACIP meets this week, so
Yeah.
that's the CDC's subcommittee.
Okay,
So what they say about the shots is what is covered by insurance by default.
Okay.
Otherwise, it's their own insurance company's own decisions what they cover. People can pay out of pocket, but who would want to do that if you already have?
so my question is, do you have the shot?
We don't have it yet.
Okay, so
We have the flu
some of
shot.
the pharmacies have it.
Yes, they do.
And it's now absolved from a prescription, right? That's what I hear from executive
No.
order.
So, the FDA has approved the COVID vaccine for over 65 and certain
Vulnerable.
chronic disease patients. So that is what's covered by the governor's executive order for pharmacies. So you can go
And
to a
that's covered
pharmacy.
under Medicare also?
So you can go to a pharmacy
Yep.
if you fit into those
Yeah,
categories
right.
and your insurance should cover it.
Okay,
If you don't fit into those categories, you do need a prescription, but from a physician.
Okay.
Your physician may or may not do that for you.
Okay.
If you have a prescription from a physician, you can also go to the pharmacy.
okay.
Several of the doctors, like at St. Peter's, are not issuing prescriptions until this meeting takes place.
Correct.
They're waiting for this meeting next week or this week, whenever.
Because it's technically an off-brand, off-license
Got it.
use, which, people have reservations about.
And there was no combining of the COVID shot with the flu shot, right? I know there was discussion of that.
That has not been brought up in some time.
Apparently pharmacies are burning through their COVID stock though.
They are.
I'm glad to hear that. According to New York State, pharmacies did 99% of the flu and COVID last year. So, I hope that's true.
And they're also recommending that the flu shot be taken, the pneumonia shot be taken this year because there's a new strain of pneumonia, which this shot will address that the prior year shots will not. So
Great.
people should talk to their GP before.
Have they
about-
changed dates, like for the flu shot?
Load them all at once, boys. We're gonna take the next 3 days off.
Like when's the best time or?
No,
It knocked me
to
down
get
last
it
when I
as fast,
doubled
but
up.
they do say the ideal time is around October, late September, October. Yeah. Just so it covers you that whole, a lot of people get it too early sometimes, and then by the time it's like February, they're.
Somebody else said they changed, I said, I have no idea, they changed stuff,
So is it in position to ask you to send us some guidance on this once that meeting is taken
I
place?
would
Could you send an email?
love to be able to do that, and I hope that I'm in the position to do that. But we will see, what happens this week.
Thank you.
And speaking of positions, we do have an impending retirement or resignation, excuse me.
We do,
And so we'll be
yes.
filling an emergency fill.
Yes, request to, fill the environmental health director position.
So right now, it's just doing the emergency fill. She'll
Mhm.
have to come to point one and all of that. This allows her to advertise
Mhm.
for it. So it's basically just asking the committee to fill an emergency fill form at this point.
Pretty
She can
please.
advertise.
Yeah.
She's desperate.
Do we have a motion? Do you need
Motion to
a
fill.
Motion.
Second.
Further discussion? All in favor? Opposed? All right, and as far as your regional, branch wanting someone in this position at all times to write the orders.
Because it is technically the permitting, official, permit issuing official.
Have you got any feedback if you can be granted that power?
I'm- Yeah, I'm
By
waiting to
default,
hear
or is
back.
there a
Yeah,
statutory?
by default. Yep.
Okay, so
Yep.
you're just waiting back. on
Yep.
it. So we
Just
don't
information.
need no motion from anywhere to assign that power to you.
No,
Like that.
Okay,
Yeah.
no.
They were probably.
Already been-
but I appreciate it.
Okay.
So you've also published the clinics that the county's gonna
Yes,
be doing,
yes.
and you're short a nurse, right?
So we are short 2 full-time nurse positions. We have a third that was approved by the full board. I converted it to an LPN. We posted it yesterday. We've gotten 11 applications. Thank you so much. 11 applications for the LPN position. I'm very excited. So hopefully we can get somebody in quickly on that so that our nurses can have some help. So there's an extremely busy time and I hate to be making a decision like that we have to reduce our outreach, especially given the circumstances, but with how things are, like, it's
So Rob, those clinics are published now. The county
Okay.
clinics are.
on the website.
Okay, great. Thank you.
Thank you.
Thank you, Director. Any further questions?
Just thank you.
Thank you so much.
All right, next up, Daniel Moss. Human Services.
Thank you. I think it's only 5 resolutions today.
You like that?
That's average for us. We're not heavy on them. I
Let's give
think.
you the benefit of the
Spread them
doubt.
out throughout the year.
That's right. That's right. First one is financial resolution, is that right?
Yep.
Yeah.
This is to accept, funds to the tune of $82,000, $969, in support of a capital project under Twin County Recovery Services. So I ask for your support to
I'll
receive
move it.
these monies and pass them on.
Do I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
It's the capital project.
It is the residential project on Fury Boulevard, the Part 20 project. Financial resolution number 2 is just asking for your support to reduce service dollars, that we have on hand at the Department of Human Services from $5,000 to $3,500.
Move it.
Thank you.
Second.
Further discussion? All in favor?
Aye.
Aye.
What's the reason?
For the reduction?
Less cash.
We're using less cash. Yes, thank you. The individuals who tap into this fund now have individual credit cards with limited balance. It allows them to be more nimble in terms of using dollars to help these individuals out of this service dollar pool of money. And so we don't need as much cash on hand. Personnel resolution, I seek your approval to create and fill a behavioral health care coordinator position. This is really the adult care coordination program.
Do I have a motion?
Second.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Everyone. Second personnel resolution is to fill a soon-to-be vacant clinical position. This is our last psychiatric social worker that's retiring. So through attrition, we've done away with the PSW title, and we've replaced it over the past probably close to 7 or 8 years now with behavioral health social workers or senior behavioral health social workers, whichever one we can find.
I'll move it.
Thank you.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And then last resolution is a general resolution to amend the contract with a nurse practitioner who is slated to start with us. She is taking on 7 hours. However, we have a nurse practitioner that's departing, so we need additional hours. So this particular nurse practitioner is willing to do a total of 14 hours now.
Great, I'll move that.
Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
That's it for me today. Thank you.
Thank you.
Department of Social Services, Commissioner Gibson.
Seat hasn't even had a chance to get warm yet.
First off,
First resolution I bring for your consideration is, to fill one caseworker position.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried. The second is to fill one legal typist position.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried. The third is, to fill one social welfare examiner position. Have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried. The third is, to fill the director of services position, non-bargaining unit.
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed?
Did she leave to go where?
Albany.
Money?
But she got a pretty substantial raise last year, so I guess it's still looking comparable to the state.
It's not the state.
Oh.
She took a deputy commissioner.
Oh, okay.
At Albany County.
Yeah. So a little bit of,
A little bit of both.
let's see.
And the environmental person who went to DEC.
Charles support.
Okay, so, number 5 is one child support specialist.
I'll move that. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried. And finally, and this is a discussion I had, with the chairman and the HR director and the controller, for reasons we contract with a medical director that also, I'm sorry, we have a medical director who also works for the health department, which sort of dictates how and when this individual gets hired and paid. So we've straightened all of that out and asking just to revise the salary and make it retroactive to 14 July.
Who does he or she report to?
Well, they're more of a consult because I can't do mandatory screenings for drugs without this
Okay.
particular oversight. So we actually,
But they're an employee, but they're almost providing a subcontracted service?
so myself, I suppose.
Initially, it was a contracted service, and then the health department, they were salary.
Right.
So you can't do both.
Who's your medical director? Who is it? The medical director. Okay.
Ramani?
Ramani, gotcha.
Who's quite excellent.
Yeah, he is. Very, very good.
Did you have a motion?
No.
No.
I would ask for that. Okay, do I have a motion? Do I have a second? Further discussion, filling the highly coveted urine analysis position. All in favor?
Aye.
Opposed? Carried. All right, a couple of things I would like to bring up very quickly. Because I really want to thank the director of the Office for the Aging, with my colleague here, who will be coming up next, helped one of the county residents through quite an ordeal last Thursday. And it was through use of that vehicle that we were able to get that done, which has made both of us start to think that maybe, we haven't discussed enough of what it would be like to partner and think about that, but we're going to do that. I have no means to take anybody who needs to be lifted because they have a scooter or they're in a wheelchair. My folks are not trained how to safely secure them in and transport with them. I learned on the fly last week, so I thought it was great. So I do appreciate that very much. And we're gonna have to think about that going forward. The other thing I would like to discuss, and I don't know if today's the day, but Director Almasi and I are going to have to sit with the supervisors about the mental health workers that we have paid and employed through the ARPA, because that money has been exhausted now. And so that's a discussion. And again, it doesn't have to happen on the record now. If there's time afterwards, maybe we could do that or go into executive.
Dan, did you put that in the budget? Your budget or?
No,
No?
it's, I don't know how much you want me to elaborate at this time. I mean, we're without a contract.
What's gonna be?
Well,
But I know that we have had discussions around the budget about it. So,
Yeah, so we'll just put a meeting together, because at this point in time, and it's fine, because there's money, there's still work being done. I do think it's valuable, by the way. I'm not trying to disparage it at all. In fact, I would encourage it, but there soon will be no money left in the budget. Any questions for me? All right, well, I appreciate it, folks.
Thank you, Commissioner.
thank you.
Next up, youth development, Dr. Granite.
Haven't seen anybody in a while.
Yeah.
So I have a resolution.
Yeah, it's coming. There we go.
So the resolution that we're looking for is to continue the contracts that we've done with folks for a good amount of years. And then we have 2 new contracts. We're going to work with the Greenport Rescue Squad, and it's also what's the name of the horse mighty?
Mighty, they're high and mighty.
High and mighty.
Ghent, I believe. Yeah. So the Greenport Rescue Squad is going to come through our youth development prevention funding, because what they're trying to do is a mentor program to get EMTs. So we're going to help sponsor that.
Nice.
And the horse program deals with kids that have post-traumatic stress, those type of issues. So that's going to come from some of our sports funding. So those are the 2 new programs, and we're kind of excited about that.
I'll move this.
Second. All right, so on the first resolution, we have a motion and a second for, Greenport Rescue. No further discussion? All in favor?
Aye.
Opposed? Carried. Second resolution on the aforementioned High and Mighty Therapeutic Stables.
Move it. Second.
Further discussion? All in favor? Aye. Opposed? Carried.
Where is where are the horses?
Again,
Okay.
It's right past Hawthorne Valley School. It's
Right.
If you head east.
I met that show.
Right by the time.
Yeah.
Yeah, I'm interested.
Yeah, right.
Yeah, it's a-
Iconic part right there.
Yeah, they're called, the names of the, I know the Colton, not Colton, it's.
I know a couple of our Vietnam vets are there on a regular basis. It's really good for
the
them.
lady in charge was also the one that ran the Clawbrook summer camp this year.
Courses.
Yes.
Laura,
I was close.
I'm really happy though to hear that the Greenport Rescue Squad's participating, given the current problem with hiring or the rescue squads. It's great for kids to get exposed
Yes, yeah.
at an early age. Especially after the pit, when all the ends, maybe more people will want to go into.
Have you seen that show?
No.
He deserves every award.
Did
It's
it?
fantastic.
I heard him on Fresh Air. It sounded like a great.
It's great. She watched it. So
I like these asides. What is the show?
The pit.
it's called The Pit. It's on HBO and Noah Wiley. I don't know if you want me to get into that now. We can get after.
Oh, I was thinking of the platform. Yeah, never see that. Oh.
Keep up to them. Come on.
So the other thing I would mention too is that working with Annie and the county attorney's office, we're not doing contracts anymore. We're doing MOUs. So it's a lot less paperwork necessary. So I think everybody's pretty happy about that.
Are these 2 programs renewable each year?
They will be,
Okay,
they will be.
because I saw an MOU for Nina's program, but I don't think I saw one for yours. Is it in the packet and I missed it?
Or which one's that?
The MOU for the rescue squad.
We don't bring that here.
Okay,
We just have to do MOUs with them after you get permission for us to go.
You're supposed to send a sample of the MOU so they can read it, so they know what they're entering.
Oh.
Sorry.
that's all right.
Or something new.
It's good.
But you got your resolutions approved,
Yeah.
so let's get those MOUs out for our edification and
And you're ready to go.
we'll move on.
Right.
I'd also like to recognize Director Granite for coming out, not only for originally securing the town of Chatham pickleball courts, but came out for the photo op to conclude that process. And
Yes, and we have another town that's kind of moving in that direction too, so I'm sure they're gonna be looking for your town to kind of replicate all the paperwork and all that type of stuff.
Sure.
So just want you to know, we had 3 months of pickleball and no noise complaints. Everybody in town kept saying, oh, you're gonna have all these noise complaints.
Really?
No, it's single.
Their course looked absolutely amazing out there.
Yeah, it did.
They really did, they came out great.
Yeah.
So that's great.
Can I add a couple things? Because I haven't seen you guys in a while.
Sure, I'm moving at a record pace right now.
Are you
For some
doing,
reason.
you didn't do this last resolution?
I'll make a motion on that one.
Okay, so this is
You could have
a
seconded
list of
all yours,
providers. So everyone's the same that we did last year. The only one that we're not doing, this is the Twin Counties. We helped them last year with they had like a speaker come in and do a big thing with teenagers, and they weren't doing it this year, so they didn't apply. So, but everyone else did it.
All right, all in favor? Aye. Opposed? Carried.
All right, the SWIMS grant, everybody should be getting their checks pretty soon, because it was also, did anybody get their checks yet?
Not yet.
Not yet, okay. But all the paperwork's done, all the expenditures in, filled out the invoices, and everything was sent down. So,
That was really nice. We were able to do certifications with it. We were able
Yeah.
to do bonuses.
yeah, well, so we're looking to see if they're gonna do it again this year. I haven't heard yet, but we're looking into it.
Let us know if you need some support. We'll
Okay.
throw ourselves
Yeah.
behind it for you.
Okay, perfect. So again, Bindleston Circus that, the commission supports, they did 6 summer camps. Again, a lot of good feedback. They did before, 3 towns in the city. And this weekend will be the last one for the year out Stockport's town.
28.
The 20th. Let's see, talk about that. The 2026 Youth Leadership Banquet, we settled on May 20th. It's gonna be a Wednesday night again, and we thank everyone for coming there and supporting us.
I'll put it on my calendar.
Yes, yeah, it's important that you have it on your calendar. The Youth Bureau Conference for the Office of Family Services is November 19th to the 21st in Albany, so I'll be attending that. Our Columbia County Youth Advisory Board meetings is going to be on 10/15, 1/21, and 4/15 this year. And what's good about that is what we've been able to do is every quarter that we have a meeting, we bring in one of our vendors. So everybody on the committee gets to hear exactly what's going on, and they also have the option to go and see the program as well. So that's good. One thing that we're doing, Commissioner and I and the Sheriff, we're working with the local American Legion. They're doing a public service job fair on October 4th, 9 to 1 at Columbia Green. So we're in the process of trying to drum up as much activity with teenagers and younger adults who are looking to enter the field, but and getting folks to table at the event.
Where did you say it was?
Columbia Green.
Okay.
Let's see. I was able to visit 10 summer camps this year, so I got to, this county's pretty large.
Yeah.
I got to Livingston, I got 11. I can get to every camp now. There's only one camp that I still need GPS, and that's Rob's Austin's camp. I still
Don't know where those.
That's because you gotta go off the road and find it at the campground, right?
I struggled.
Can you find it, Rob?
I can find it. They start out right at the town park, then they go up to the, Fox Hill Campgrounds.
I Think Differently program again went well this year, the 9/20 Sensory Day. We had over 1,300 people in the sensory space this at the Chatham Fair. Again, I got to just share a short story with you, because the commissioner and I was out there for the Sensory Day, and also the Green Court supervisor was there. And so as we're talking to Lisa and, how we're trying to keep the tone, everything down, we're doing a watermelon eating contest, like right there. We're like, can you keep it down a little bit? And so then we go down and we're having something for lunch, and we run to the supervisor and we're talking, and all of a sudden one of the rides starts with their music. And we're like, me and Mark, man, we got to stop this stuff. And all of a sudden I turn around and the supervisor's gone. And I'm like, what is she doing? She was over there telling them to turn the damn music down.
Turn the music down. I said, nobody talk. I said, since we got no music.
Yeah,
nobody
so that
talking."
was,
I
he,
said,
and
"Well, I
he
just
did,
did.
he did.
Turn it down."
So that was nice. We
It
appreciated
was
that.
good.
So our 2024-25 expenditures and annual reports are just about done. And our 25-26 wrap is in the process of being approved. So we're pretty much completed that. And we've been getting some really good feedback from the state that we're the first county to have our wrap in and all. So we're moving along pretty good.
You know, about the Sensory Day at the fair, I know a few people that bring their kids there. And when I left, there were some kids that were having a hard time when I was going, and, I felt, it was much deserved what they get. And some of the kids still bring their headphones because there's no noise, but they put the headphones on because there's still a lot of stimulation from the people and the stuff I see. But the parents are so appreciative of the lack of the stimulation that still, that gets to us after a while, you know, so.
Well, I'll tell you, the commission invested some more money out there, and Cornell did a really nice job. They like retrofit it. So, I mean, there's like a ceiling now that they take down because of the weather during the year, and then they put it back up. Really, Cornell's main department does a great job.
It was nice. I thought they were gonna boot me out of there. I was lingering so long.
Yeah. Oh, that's.
And so the other one is Cornell, which is a great collaborator with us. They do something which is a healthy food program. So we were able to, they had two opportunities. So we use Morris Memorial and the Hudson Youth Center. That's going to come up in the fall. They come in and they teach how to make healthy food, healthy shakes. And so everybody gets to walk away with their own blender and the own material, ingredients to create a healthy milkshake, those type of things. So, and the only reason we chose those two is because you need a lot of outlets. And so those are the two that seem to be best fitting. But again, Cornell's a really good resource for us. They really are.
Yeah, and I was grateful for the Board of Supervisors for helping use a little ARPA money for their programming and so on. Very nice.
Yeah.
Thank you. All right, any further questions for Director Grandinetti? Thank you, sir.
Thank you.
Thanks.
Thank you.
Last but not least, Office of the Aging.
All right. Very short content for each night. The first resolution is authorization to purchase a vehicle using our ISEP funds, that expanded in-home supports for the elderly. This would be solely for one of our personal care aides to use, and then we plan to purchase another vehicle next year with the same funds. Well, not the same funds. Next year's funds, the same program for the other person.
Is there a dollar amount on that? Roughly.
There is. I can't remember what it is off the top of my head because I have 2026 numbers stuck in my head and this is coming out of 2025.
Okay.
But there's more than enough to cover a vehicle and some left over.
Are there still rebates for electrical vehicles? Could we get a hybrid or electrical vehicle at a lower price? Is this a lease or buy?
It would be a buy. Right now, we have a lease vehicle for her. We would be looking for a hybrid.
I think you had to take ownership by
September,
30th.
it was early September, I think was the last.
Last one I heard was September 30. I thought,
You
but
could be right, but I think.
it was also taking delivery of that.
That's not gonna happen now. And is there a reason why we're buying it?
The state may change that. I think that the state's gonna maybe next year's budget, but I think the state has been talking about trying to make up for some of that $7,500 rebate statewide. I don't know where we'll get that money from, but they'll.
I'm just saying we're putting in all these chargers and
Right.
nice when, put them to use, make them less expensive.
But again, that program has kind of done what it's needed to do. It's got them out there. It's got people buying. It's got this, the need for chargers. So, and they will become more affordable.
And is there a reason we're buying this instead of leasing it?
Because we have this ISEP funding. Oh, you have a message. This ISEP funding, historically, from my understanding, our department has not always spent the total amount. And when I found out that there was still money on the table, I was like, well, there's gotta be a way to use this.
Okay.
So I brainstormed a little bit with NYSOFA. What are the parameters for the use of these funds? And one of the big discussions that we had with the director of NYSOFA and their fiscal team was, well, in order to provide in-home supports, right, you've got to be able to get to the home. So I guess it doesn't really answer lease
It does,
versus
no, it does.
purchase, but
So we currently have 3 personal care aides,
we have 2 full-time aides and 1 per diem aide,
and so this would go to one of the full-times?
one of the full-times. And then the plan is next year to use that same fund, some of that
To get
money
for the other
for the other
Do
full-time.
we currently pay the mileage?
We do not, they use
Okay.
county
I was
vehicles.
just wondering if there was some savings associated with their using a county car.
Did you, obviously you run this by Jim.
Jim and I had multiple phone calls about this.
And what kind of vehicle? I mean, is it
Right
like a
now-
Toyota Corolla kind of thing? or-
Right now, she has an SUV. We want something with all-wheel drive because we want to make sure
Where
during,
she's going.
during the, winter weather, she
So
can
you get
actually
also
still
lesser
get out.
funding.
How about a turbo diesel?
We gotta find those kids up there.
We could throw a plow.
Might have to pull some firewood up there somewhere. All right.
I think she's got like a Toyota now.
You do we have a second? Okay. No, I need a
I'll
second on
second
this.
it.
Okay.
After asking all those questions.
Further
I'll second it.
discussion? All in favor? Opposed? Carried.
I have one question on the PCAs. Are those lists, are they exhausted? Is there a waiting list?
Well, I don't have my, like next month, I'll have that quarterly report, which is where that's where I get my check-in. There, if I remember correctly, there are 2 folks that are considered on a waiting list, but it's specific circumstances. You know, the way that our schedule is built out for these PCAs, they are not available. They won't be home during those time slots that our PCA has available. And then when it comes to our contracts with the other 8 agencies in the county, it's very difficult to match them with somebody because there's an aid shortage kind of everywhere.
Well, going back to Thursday, that gentleman was on the list for a private, one of them. And, and that's why I asked, I thought, and we did this, I was part of this committee because you just simply can't get aids.
Yeah.
That's why we did the car. Because,
Well, we had given the extra money. to it. I remember when we did the program and people were on a waiting list. So with 2 full-time and a part-time, people are not on a waiting list in the county?
There's not a substantial waiting
Really?
list. It fluctuates.
Yeah.
It changes from time to time. It depends on what the needs are. It depends on, if someone's coming in through, for example, Medicaid, right? If someone's on Medicaid, we typically would send them over to DSS, but that's kind of been evolving too. So now is it PCA 1 we are now doing?
because the higher level is the tougher.
Right, so there's 2 levels of service. There's PCA 1, which is kind of light housekeeping, light touch service, and then there's PCA 2, which is more hands-on assistance with toileting, shower, and things like
And
that.
what's typically the duration of time that they would go to somebody's house? Is it all day or is it?
It depends on where they live in the county, right? We're gonna give a bigger chunk for somebody in Austerlitz because it takes them a while to get out
You
there
have to.
versus somebody in Hudson. It depends on what level they are. If someone has PCA 1, they're not necessarily going to need as much time as someone with PCA 2 because.
So they would go to more than one place in the day?
Oh, yeah. That schedule, it's color coded, because we love color coded things at OFA.
But they would never be at one person's house for a full day.
No,
if they
usually like 2-hour blocks, again, depending on where they are. There are some folks who will get 1 hour on a Tuesday, 1 hour on a Thursday. Some folks will get 2 hours on a Tuesday. That's it for the week type thing. It's there's a lot that goes into it. And it's always changing. So depending on someone's needs, right? Maybe we have Alfred gets 2 hours every Tuesday, but now he just got a new diagnosis. He needs new treatment. He has to go to a weekly appointment. He's got to move his schedule around. We try really hard to be able to plug and play kind of.
Well, I guess my question was, is there a maximum amount of time that we would send somebody to anybody's house for whatever reason?
There is a max. There's a max per day. There's a max per year.
Okay. What's the max per day?
The max per day.
Does this include drive time or not include drive time?
The drive time does not.
Now you're
not
really
calculated.
asking hard questions.
Right.
No, because I know the block is for
Yeah,
kids.
I'm not putting you on the spot, but it'd be nice to know because we do have people that ask all the time, and I didn't know if we even had somebody available that someone needed 4 hours a day or 5 hours on a day.
I would
I just
say,
didn't know if that was even something that the program.
I would say 2, although I'm not, I don't feel super confident in a hard number. I'd have to actually look at the PI, but roughly 2 hours is what we typically send people to. And that's the ISEP program. Respite is a little bit different. Because, ISEP is kind of a more long-term program, right? ISEP is for someone who doesn't necessarily have a caregiver with them, whereas respite would be for someone who has a caregiver, and our client is technically the caregiver in that situation. So that could, that's going to be a 6-month lot of time that we're going to this person's house to provide relief for the caregiver. And it's not always hands-on. It is a little more companion style, if you will.
To Rob's question, is this something that would be like once a week or multiple days a week? Multiple?
Typically once a week, but again, it depends on kind of how the schedule falls. If we have one of our aides, Janelle, if she has 2 1-hour slots and we have someone that needs services and they're willing to take an hour this day, an hour this day, and it makes sense, we'll slot them in that way. Or we'll put them all on one day. It's very case by case.
There's a growing problem because Eddie has now decided not to come to New Lebanon, Canaan, and I don't know about Austerlitz, but their visiting nurses were coming from St. Peter's to that corner of the world, and they decided 6-8 weeks ago they're not going to do that any longer. So now even people that can pay can't get services because Eddie's not going to serve that area anymore.
A big part of the reason that I believe, at least because it still happens today, that we ended up bringing on our own PCAs on staff is because even you have the 8 agencies in Hudson are not going to pick up cases in Canaan, Austerlitz, Livingston, because they don't want to drive that far. They're only going to pick up the cases in Hudson or Greenport.
That's the reason we hired our own, so that we can cover that.
Right.
Did we, originally when we talked about this, we were going to do 3. Are we looking to hire a 3rd person if we can find them? Did we budget to hire a 3rd?
We still have in our budget a per diem, I believe. If I'm not mistaken, we've got the 2 full-time. It started.
There's 2 part-timers, weren't there?
Oh, boy. You guys are really.
I thought it was 2 full-time and 2 part-time.
Yeah.
I believe, and I could be wrong, I wasn't here, but from my understanding, I believe it was 4 part-time that were merged into the 2 full-time.
I don't think so. It's not my memory. We can check it
We'll
out.
search the archives.
There was definitely a pool of part-timers that was then merged into the 2 full-time.
Could have been, but my recollection was we had 1 full-timer and then we had some part-time individuals. Then we
Maybe that
had a
was-
second full-time person. And now we have 2 full-timers plus.
1 per diem.
Yeah,
And
so that,
there's-
I mean, again, that was quite a while ago, Bob. that we worked on this.
And I think it's moved up and down based on our
Right.
ability to hire, not
Sure.
on the need. but the
It's
ability
very
to hire.
difficult to find interest in a per diem position. So a goal of mine in the future would be to turn that per diem in, merge those 2 per diems to bring on another full-time.
When we brought the other full-timer, it was because we raised the pay quite a bit. And then we were able to bring individuals prior to that.
And that knocked down the waiting list.
Yeah.
Yes.
exactly.
And it's been a
Really
big
quick.
value added, I'll tell you, and this Eddie is not good news, because that's gonna put a lot of pressure on this. It's, we saw it in real time, right? I mean, that gentleman is gonna end up in long-term care, and that's way more than any of this stuff costs. So, that's why I do think what you've been doing is great. Those private companies still aren't gonna go to King. They're just, they're gonna say it's not worth the $17 an hour because I don't get reimbursed. So that's right. Been the value added.
Right.
And it has made a big difference. I mean, my folks have said that. It made a huge difference.
Oh, yeah. You can-
But the Eddie's not gonna be doing us any favors.
Was it the aides or the nurses?
It's both.
Both.
It's
So
both.
why did they pull out? Because it's not worth it to them?
Yeah, I think it ends up a bottom line thing, right? If the margins aren't
Yeah.
being met, then why do we want to do it? And then that's just going to tax the Medicaid system because they're going to go long-term care. And we're already, this county pays more than its share, as we all know.
But that raised the question, which I was going to ask today, if someone can pay but can't find someone, where do we send them? What do they do?
There's a few agencies that we will unofficially
Suggest they
inform
talk
people
to.
of. Yeah, we don't necessarily recommend anything, but these are agencies that other clients use.
There's also groups around that are not formal groups
Right.
that are working through, I know some, that there's a group of women.
Yeah.
Men and women. that get-
Care.com.
Not volunteer, they get paid, but they'll, someone needs help, they sort of team together. They rotate shifts, they get paid however they get paid. So there are those groups around, and I think quite a few of those groups actually.
And when it comes to those, we also, anytime we talk to somebody, we'll also give them, there's like a list of questions you want to ask a provider. So you can double check all sorts of things. AARP actually is typically the list that we provide. It's got a really good
Right.
checklist for when you're going into, a skilled nursing facility, or you're trying to interview an aide to come into the home. They have really good checklists, questions that, you know, even though I do this day in and day out, I might not actually think about in the moment in an interview. So, you know, we'll suggest these are places you can look. Some people have put messages up on Facebook community boards. And we.
But we're only suggesting those that are legitimate,
We don't suggest anything.
or where they look.
We
I mean,
say
'cause
these
some
are
of these groups, I'm not saying they
resources.
do a bad job at all.
Right.
But they're, you know, I don't know if they're in compliance with what they need to be.
That's usually the conversation that we have. We can't actually recommend anything or suggest anything. And then we give them the resources to be able to do kind of their homework and test it out.
Okay, I'll talk to you more about this offline. This is, we're feeling some pressure already for this. So, thank you.
Is there income criteria for the recipients?
It depends on the program.
Okay,
For ISEP is the only income threshold program that we have.
okay.
And there's been whispers that that may also be changing in the future at the state level, although we haven't heard anything yet. So ISEP there's a threshold, income threshold, and then based on that income threshold, there is a cost share program.
Gotcha.
And then respite, there is no, income threshold or any type of,
And the rest is the program that fills in.
when someone is a caregiver,
Okay.
yes. So respite is the caregiver services. ISEP, expanded in-home supports for the elderly, is folks that don't necessarily have a caregiver at home. So folks that we do have a handful, although I can't think of our exact caseload off the top of my head right now. But we do have some folks that are on the ISEP list who fall into 100% cost share, but they can't find anybody else. They can't, no one will go there. So we try to work with them as best we can, so that, you know, we prioritize who needs the service, how long they've had it. There's constant, assessments going on with the case managers to kind of figure out where people fall.
The other issue that we're managing is because we're on the border. It used to be that Massachusetts services would come into New York State, but as the insurance regs are tightening down, that's not gonna happen now. So that's the other pressure.
Right on the board.
Right.
And what does that acronym stand for?
ISEP,
Yeah.
expanded in-home supports for the elderly program.
Which was E, so.
In EIH.
That was I said, the way it sounds phonetically.
EISEP, yeah.
EISEP.
Not
to be confused with IQIP, which are the robots that are gonna take.
Randall, it's on my screen.
Yeah.
Expanded in-home supports for the
Yeah. That one trips me up a lot.
All right. Let's move on to our next resolution.
This actually leads directly into the next resolution, which is with a nice bow on top, request to implement a pilot respite program. So everything that we were just talking about kind of leads into how we got into this conversation. That, you know, there's a shortage of personal care aides. There is a shortage of social adult day centers. There's only one in our entire county. Is it Valencia? The Social House. If you haven't been there, it's great. Check it out. We've partnered with them. We are hoping to continue to kind of work together on anything that we can imagine to support the caregivers in the county, but they are open, and I have it.
Where is it?
Right next, is that Route 9? Oh, God.
28 and 9, the old Dickelman's.
Next
lumberyard.
to Steiner's.
Is that what was there?
They rent space in the back of that church that I, of course, can't remember the name of.
Next to Mavis Tire.
Yeah.
Yes,
Exactly where it is, yeah.
right in there. If you have a chance to go in and check it out, I really do highly recommend it. It's an awesome facility. They have awesome staff. Coming from someone who is very passionate about dementia and Alzheimer's, they have it set up. You know, they've got huge murals on the wall to make it feel like you're in kind of, in the 50s soda fountain place.
So it's your shop.
That's a,
Malt shop.
that's what, yeah.
I'm not old enough for that.
Yeah. So we
We'd have to
want,
ask your dad about that, you know.
we want to supplement what there is already, and that's the only thing that exists right now. You know, we have our in-home supports, but there is a real need for out-of-home, during the day supports. we would like to, and I did it, kind of typed up a whole proposal for you, which probably is way too wordy because I'm good at that, but feel free to ask any questions. We would open up a location in Canaan and a location in Chatham in partnership with two faith-based churches that have agreed to work with us on this project. I also just found out, when I put this together, I was still putting down that rent would be $200 a month for the Chatham location. I just found out we are going to be getting the parishioner rate of $100 a month. So that brings us down, which is very exciting. So,
The Lord's a generous one.
yeah, the idea would be that we would operate these locations one day a month to get started with the goal of growing and increasing. And then my real reach goal is to then take this and duplicate it in the southern part of the county as well in the future. But we would have our sites run on the days that the social house is not open. I should also mention that the social house is great, but there is a cost for people to attend. Our program would be free for caregivers within the county. This falls within our existing respite program, the National Family Caregiver Support Program, I believe is the full title of that. So I have full support from the state. NYSOFA has looked over everything we put together. They're behind us on this. We have a contracted employee, Michelle Cram, who her contract for 2025 was to really work on this. It was to establish and build up what exists for caregivers in the county. We also, looking at the 2026 budget, I kind of split that contract out based on what she's used so far this year and what this would look like for at least the next year to create a secondary caregiver coordinator position. So we would have two kind of staff, contracted staff members, and the rest would fall upon volunteers, which we've dipped the toe into the pool to try and gauge volunteer interest. And it sounds like we've collected quite a few folks who are really willing to help out their neighbors, which I think is really exciting. We have confirmation from the Alzheimer's Association and NYSARC, New York State Caregiving Coalition, I got it typed out somewhere in here.
Caregiving and Respite Coalition.
Thank you. They would provide training. Once a volunteer, this actually brings me back to that earlier question about finding folks that can provide respite or in-home care. With that NYSARC training, when someone goes through the respite training, they are actually listed on the respite provider kind of directory through the state. They have the option to be live or not, but then they've gone through this training that is state approved. They are up for folks to actually reach out to them and if they're comfortable to provide in-home respite as well. So the volunteers aren't just benefiting by helping out their neighbors, their community members, they're also gaining a skill that they can put onto a resume that they can, use to better themselves as well. There's no truly altruistic act, right? They say. Trying to think the big parts. I get excited about this, so then I kind of just go off the deep end. As part of the day structure of these programs, we would be providing meals through the OFA nutrition program for attendees. Anyone as a caregiver, anyone who comes into the system would then be matched up with a case manager because they are a part of that respite program within our office. They'd be getting the CII caregiver indicator. That's not right. Caregiver intensity index.
Evaluation.
Yes. Which tracks, I actually really like this. It's fairly new. They introduced it about a year or two ago. You ask a bunch of questions. It kind of gauges where someone is in their caregiver journey, and it actually gives you results with numbers and color coordinated. So if someone is experiencing caregiver burnout, if you will, I don't like it because it has a negative connotation to it, but experiencing caregiver burnout, they'll have a higher score and their color will be red. And then you're tracking what individualized care plans they're given by working with this case manager and being part of this respite program. You're tracking. So then in 6 months, you do that CII again, and hopefully they're down in the yellow now because some of those individualized programs and services that you put into place with them are actually making an impact. those two caregiver coordinators would be doing things like arts and crafts, modified board games. We have specific for dementia and the aging population. We talked about specifically having chairs that have arms to them because it actually assists with independent mobility. That brings me to another point. The folks that would be eligible to attend need to be independent in some capacity, right? They are typically not being able to be left at home unsupervised, but they're able to toilet themselves. They're able to feed themselves. If there's medication they need to take while they are at this program, they are able to administer it themselves. So it's not going to solve all the problems, but I think there's a real possibility for this to solve quite a few problems and continue to grow and make a big impact. I think it's something our area desperately needs. In my conversations with the state, with NYSOFA, they explained Rensselaer County just above us, they don't have any social adult day centers in their county as a whole. I don't think we're there yet by any means, but this could potentially turn into a revenue source if we were to do an MOU with that county and allow their residents to take advantage of it as well. We would partner with, some of the subcontractors that we already use at the senior centers for things like Tai Chi, chair yoga, different things like Zumba Gold, stuff like that, to try and do, programs that are going to benefit someone while they're with us for the 4 hours. There's a lot of other ideas we have for if it were to grow. We got the money from SOFA, the NGA, that left over Everhome pilot money.
Congratulations.
We got it. We got it last week. It's been quite a journey, but it is ours now.
You earned it.
So one of the other documents that I submitted was the work plan kind of for that leftover money. A good chunk of it we're going to put into upgrading our kitchen and nutrition program because that's where a big need is. But 10,000 of that money is going to go directly in support of this respite program. We also won from NYSARC, that entity that is doing the training for us and has the respite provider directory. We won a mini grant through them as well. So that's $20,000 in the pocket that we have right now. If you pass this resolution and let me accept it, that is. And then we also have been told we would be getting another $15,000 grant from Assemblyman Dee Bear, although I don't have that in my hand just yet.
Okay.
Is that a DASNY grant?
DASNY?
DASNY, that's the way they push the money out. So.
Sure. I don't know. Actually.
She hasn't got that far.
You will learn.
I'm sure it's a lot of work. I mean, this has been a lot of work. This has been months and months and months in the making, but every step we take, we get closer and closer. I'm really excited about it. I think there's a huge need for this. I think the idea, Michelle Cram, prior to being a consultant for OFA, worked in the OFA. She was the deputy director, and this has been a goal and a dream of hers for years on end. So I know we've got good people that are behind this. I feel really good about it.
We also have NNCC, Northern Neighbors of Columbia County, as we got a beginning conversation with them about a partnership as well. And a private foundation contacted me a week ago with an interest in this document because they think they'd be interested in funding this. So I think this is a well understood need that is not being met on any level. So I think you really get a lot of kudos for getting out in front of this and for getting us started.
As do you, so I'd like to recognize your efforts on Kane's behalf and moving this forward. So thank you, Supervisor Adams. Thank you. Now I'd ask for a motion.
Motion.
Do I have a second? Further discussion? This sounds fantastic. Looking forward to it. All in favor? Aye. Opposed? Carried.
Thank you. And that's all I got because I could not. We had 316 people at Senior Day, and then I'll give you a quarter update next month.
So
But
you stopped accepting at 250 and then they just kept coming? They came without a reservation? Oh, that's wonderful.
it is. It's terrifying, but wonderful.
Yeah.
So as we are recuperating, although I feel much more energized now that I've slept a little bit, we are making plans for maybe next year. How can we turn this into more of a public event? We ended up implementing, I actually can't remember how much of this I said at at the board meeting if I talked about it at all, but we ended up implementing wristbands for folks that were registered so that they would definitely get food, because we had 400 chickens. But that was 400 chickens, the meals to cover all of the guests, the vendors and staff. And then, you know, there were folks that didn't register, but just showed up day of because they saw our fancy, the sandwich board out front, or they had heard me talking about it, screaming it for months on end because I was so excited. So we want it to turn into something where anyone can come, because anyone can walk through that vendor tent and, you know, connect with our partner agencies, right? Figuring out how to do food so that there's other components that everyone can benefit from is, we're gonna think about it for next year. I'm already planning for next year. now.
Polite. People called me and said, the reservations are full. Can we go? And I said, no, they're serving food. You can't go.
And then, but then they show up,
Oh,
which is why we.
They were probably there early too, right?
Free food, they show up.
oh,
We
yeah.
implemented the wristbands, even the health department, when I told them, like, our list went up a little bit. They're like, we don't have enough flu shots. It worked out. They did get enough flu shots, but
Congratulations.
It was fantastic. You did a marvelous job. It was nice to see all the different providers, everyone from DSS and Planner's Department, Sheriff. I mean,
yeah, we had a ton. We had
even real property tax was there.
We had vendors calling us saying, I heard about this event. Can we come? I said, do you have a table and a tent? Sure. Why not? I haven't put the video up yet, but I will put it up probably sometime tomorrow. We had a 14-year-old sing the national anthem. I cried like a baby. She has the voice of an angel. I'm not just saying that, she actually was fantastic. She's a family member of one of our staff, and we want to try and really bulk up some of our intergenerational, you know, programming and things like that. So I thought that was a fantastic way to bring it in. I can't wait for you to see the video. She was.
Yeah.
It was, and there was some ferocious game playing going on.
Oh, yeah.
I mean, I thought they were gonna roll up their sleeves and whack.
The raffle.
Oh, man. It was just
Oh, we raised.
so competitive.
Yeah, we raised almost, I think, $1,000 in total to split between our Senior Stars program and the veterans, Columbia County veterans. We split with them, and then we were collecting donations for the Edith Casey Stocking Fund. So I like that it's, you know, gets people excited and doing good things. And
And was very happy.
yeah,
Very happy.
I'm not gonna lie, we didn't get as many donations on the table. The puppies last year brought in a little bit more. But that's, we'll work on it, yeah. Bring the puppies back. Thank you.
All right, this guy's here, so I have to call us meeting close. Just kidding. Any further questions for Director Benvenuto? She did a marvelous job.
I have some thoughts on the MOU. I'll get back to you.
Okay. Thank you. Anything from the supervisors? Anything from the public? Thank you all. I'm gonna ask for a motion to adjourn.
So greatly would appreciate if you guys would pay for some of the toiletries.
Reagan? Who's Reagan?
Is this at the Hudson Senior Center? So as part of our contract,
We have a contract.
we have a contract with the city of Hudson,
Okay,
and that's not
that's not part of it.
that's in the contract, but it's not our responsibility as it's outlined in the contract.
All right, I'm just saying what Reagan has said.
We're adjourned, right?
Not yet.
Not yet.
I'm with your issue here, man.
We have a motion. Can I get a second?
Second.
All in favor?
Aye.
Opposed?
Thank you.
Thank you.
Thank you.